Imagine this. You wake up on a Tuesday morning, you make your coffee, you sit down at the kitchen table, and you open your bank statement like you do every month, but something is wrong. Your usual payment from Medicaid, the one that helps pay for your home care aide or your adult daughter who helps you bathe, or your husband's nursing home bed, that payment is not there, or worse. You open a letter from the state. It says your Medicaid coverage has changed. It says you need to prove you are working 80 hours a month. You're 68 years old. You retired a decade ago. Your heart starts racing. You feel confused. You feel afraid. You ask yourself, did I do something wrong? Am I going to lose my care? I am Milena. I am a Senior Policy Analyst. I have spent my career helping retirees understand complicated government rules. And I am here today to tell you the truth about a new law that has already been signed. It is called the One Big Beautiful Bill Act. It cuts $911 billion from Medicaid over the next 10 years. I will explain exactly what changed. I will tell you the steps you must take to protect your benefits. And I need you to stay with me until the end, because there is a hidden mistake that many seniors make, a small mistake that can cost you your nursing home care or your home health aide. Let me tell you about a woman I will call Margaret. Margaret is 72 years old. She lives alone. She has arthritis and diabetes. She receives Medicaid home care 5 days a week. A nice woman comes to help her cook, clean, and get to doctor appointments. Margaret heard about the new law on the news. She thought, I am over 65. The work requirements don't apply to me. I am safe, see I. So she did nothing. But 6 months later, Margaret received a letter. Her home care hours were cut in half. Why? Because her state lost billions in federal funding. They had to cap enrollment for home care services. Margaret did nothing wrong. She just did not know that the cuts go far beyond work requirements. Now she is scared. She cannot cook for herself every day. She cannot clean her home. She is worried she will have to move into a nursing home, which she cannot afford. Margaret's story is not unique. It will happen to millions of seniors unless you act now. So let me explain the rule in simple language. Medicaid is the #1 payer for nursing home care in America. 6 out of 10 nursing home residents rely on Medicaid. It also pays for nearly 70% of all home care in this country. Medicare does not pay for long-term nursing home care. Many people believe that, but it is a myth. Medicare pays for only up to 100 days of skilled nursing after a hospital stay. After that, you are on your own. Medicaid is the program that actually pays for long-term care. The new law cuts $911 billion from Medicaid. That is about a 14% reduction in federal funding. The Congressional Budget Office, a nonpartisan group, confirms this number. Here is what that means for you. First, work requirements start no later than December 31st of this year. Adults between 19 and 64 must work, volunteer, or go to school for 80 hours a month. If you are 65 or older, you are exempt from the work hours, but here's the trap. If you are between 50 and 64, you are not exempt. That means you could lose your coverage if you do not report your hours correctly. Second, states must now re-verify your eligibility every 6 months instead of every 12. That doubles your paperwork. Miss one form, you could lose your coverage. Third, the law freezes new enrollment rules that would have made it easier to sign up for the Medicare Savings Program. That program helps low-income seniors pay their Medicare premiums. Those rules are now frozen until 2034. Fourth, there is a new home equity cap. Starting in 2028, if your home is worth more than $1 million, you cannot qualify for Medicaid long-term care. And that $1 million cap does not adjust for inflation. So as home values rise, more and more seniors will be pushed out of coverage. Fifth, retroactive coverage is being cut. Before this law, if you applied for Medicaid, they would pay for expenses from the previous 90 days. Now it is just 1 month for some people and 2 months for others. That means if you are even 1 month late applying, you could owe thousands of dollars in nursing home bills out of your own pocket. And sixth, the nursing home staffing rule is delayed until 2034. That rule would have required more nurses and aides in every facility. Without it, nursing homes can keep low staffing levels. That means worse care, more bed sores, more falls, more neglect. So what should you do? I am going to give you 3 exact actions you must take. Not suggestions, actions. Step 1, verify your Medicaid status right now. Do not wait. Call your state Medicaid office. Ask them, am I currently enrolled? When is my next renewal date? Do I need to report anything new? Write down the name of the person you speak to. Write down the date and time. Step 2, If you are between 50 and 64, start documenting everything. Keep a log of your work hours, volunteer hours, or job training hours. Keep proof of any medical condition that might make you exempt. Do not rely on the state to figure this out for you. In Arkansas, when they tried work requirements before, 70% of people who lost coverage lost it because they failed to report, not because they were ineligible. They were working. They qualified for exemptions, but they could not navigate the paperwork. Do not let that be you. Step 3. If you have a family member who helps care for you, an adult child, a spouse, a grandchild, make sure they understand the caregiver exemption. The law exempts caregivers of people with disabilities, but you may need to prove that. Get a letter from your doctor. Keep records of the care they provide. Do not assume the state will automatically know. And here is the hidden mistake I promised to tell you about. Most seniors think that if they qualify for an exemption, like being over 65 or being medically frail, they are completely safe. That is wrong. Even if you are exempt from work requirements, you still have to report your exemption. You still have to fill out the forms. You still have to document your condition. If you do not, the computer system will automatically flag you as non-compliant and you will lose your coverage. Do not assume the government knows your situation. They do not. You must tell them, on paper, every time. One more thing, if you lose Medicaid because you cannot meet the work requirements, you cannot fall back on the Affordable Care Act marketplaces. The law makes you ineligible for subsidized coverage. There is no safety net. You will be uninsured. That is terrifying. But you can prevent it by acting now. I know this is overwhelming. I know you did not ask for these complicated rules, but I also know that you worked your entire life for a secure retirement. You paid taxes. You played by the rules, and you deserve to keep the care you need. So here is my urgent call to action. Do not rely only on YouTube to tell you when things change. The algorithms are not reliable. Important updates can get buried. Click the link in the description below this video. Join the Global Senior Alerts official WhatsApp channel. When you join, you can download a free Senior Benefits Protection Guide. That guide walks you through every form you need, every deadline, every exemption, and you will receive real-time alerts about Social Security changes, pension rules, bank regulations, insurance policy updates, and travel rules for seniors. No waiting, no guessing. You are not alone in this. Thousands of seniors are joining every day. Be one of them. Protect your benefits, protect your home care, protect your nursing home bed. I am Milena. Thank you for listening. Now go click that link.